Cahill. I am the Executive Director of Fordham University's Institute of International Humanitarian Affairs, and it's my great pleasure to welcome you to the Mental Health and Complex Emergencies course. The Mental Health and Complex Emergencies course is incredibly innovative, and I look forward to seeing you all one day soon. Thank you very much.
Hello, everyone. My name is Willem van der Put. Lynn and I started this course many years ago, I think in 2004. Well, throughout the years, we found that in working on the field of mental health and complex emergencies, there were many lessons to be learned and experiences to be shared. That's how we started the course. That is why through the wonderful network of Lynn, we managed to find fantastic teachers and trainers, but also get many wonderful students on board. What we will try to do is to keep up with the changing times, because the times, they are changing, as they say, and they're changing quite fast now. The humanitarian world is not what it used to be. Crises are different now than they used to be 10 to 20 years ago. And we want to follow these developments to make sure that we are up to the challenge of meeting the needs of people who really need support. So I hope that we'll meet soon in this growing community of people who share experience through the course of mental health in complex emergencies. Thank you.
I'm Dr. Lynn Jones. I'm a child and adolescent psychiatrist by training, but I've actually been working with refugees and in emergency settings for the last 30 years, which is rather frightening. I got into this actually by marrying into a war zone, and refugees were living down the road. So I started working with them and learned as I went along, because there were no courses in those days. And so that's me. I want to tell you a little bit about the course. You do not have to be a psychiatrist or a psychologist or a health worker or a social worker to come on this course. It's great if you are and you want to learn more about working in emergencies, but if you're not and you have some experiences of working in emergencies, you're also welcome. We welcome people who are camp managers, program managers, people who deal with the water or the food. Why? Because mental health is a cross-cutting issue, and the more people who learn about it, the better it will be done and the better it will be protected. So whoever you are, if you're interested in mental health and humanitarian complex emergencies, you're welcome on this course.
I'm Peter Ventevoogel, Senior Mental Health and Psychosocial Support Officer with UNHCR, the United Nations Refugee Agency. What I keep in mind when designing the modules is always, what does the humanitarian practitioner needs to know in order to set up or manage an MHPSS program in a setting with refugees or other forcibly displaced populations. So it's that practical focus, that linking academic research with the wisdom of clinical and programmatic practice that makes this course so special.
I am Marcio Galeato, an international consultant for humanitarian responses and also the co-director of MHPSS.net, the Mental Health and Psychosocial Support Network. It is with great honor and pleasure that I received the invitation to join the Mental Health and Complex Emergencies course as one of the course directors. I have a profound respect and admiration for this course, and I have recommended this course over the years for a number of humanitarian professionals interested to gain knowledge, practical skills, and critical thinking in how to implement MHPSS programming in complex and different types of humanitarian settings. Join us for this course, and I hope to see you there.
Hello, my name is Claire Whitney. I'm the Senior Global Mental Health and Psychosocial Support Advisor at International Medical Corps. I'm a clinical social worker by training with over 15 years of experience in the humanitarian field. This course offers a very unique and valuable opportunity for those who are interested in learning more about the field of MHPSS in humanitarian emergency contexts. Inspiring participants join from all over the world, learning both from experts as well as from one another. Our hope is to cultivate increasing support and advocacy for MHPSS programming for the most vulnerable populations across the globe.
Hello, my name is Larry Hollingworth, and I am the Administrative Director of the course. And together with another administrator, we will run the course and we'll be there at every session that you're there, we will be there. Our job, in effect, is to oil the wheels and to make sure the course runs smoothly. We've done it on a number of courses now, and we've had great success. In addition to that, I will do a little bit of lecturing on security. We're looking forward to you being with us on the MHCE and you being our next cohort of graduates of the course. We'll have a great journey together.